What up though, YouTube? It's Snooze You Lose back with another fire video. Make sure y'all like, comment, and subscribe. One time for the grind. In this video, I came across this article on MSN, and it's talking about opiate patients who are attacking their doctors. I've covered the opiate crisis before on this channel, and anytime I see a case that draw my attention, I will make a reaction video about it. So in this video, it says, I'm a doctor. This was the first time a patient threatened to kill me, but not the last. The first time a patient threatened to kill me, I was a third-year medical student on a trauma surgery rotation in Texas. A 22-year-old stabbing victim kept coming back to the trauma following up clinic asking for more Delalidid, an opiate that helped lessen his pain as he was healing. I told him he had to follow up with his primary care physician. He huffed out, but then came back 4 hours. Look at this, y'all. 4 hours later, he withdrawn and asked to speak to me. I brought him to an empty clinic room for the purpose of privacy, and he proceeded to ask me how I wanted to die, by knife or gun or both. The first time a patient threatened to kill me, I was a... Wait, is this the same thing? Okay, here we go. Patients threatening doctors is not new, but it became exponentially more common as opiates prescribed to control pain became more common, with growing reports of violent threats against medical staff to procure drugs as a result, and the use of guns in these threats is common. In 2017 in India, Michael Jarvis confronted Dr. Todd Graham with a semi-automatic weapon, killing Graham then himself. Weeks earlier, the doctor refused to prescribe opiates to Jarvis. You guys see that? He refused to give opiates to Jarvis. So, just a couple weeks later, he showed up to the clinic with a semi-automatic. Okay. Jarvis' wife for her chronic pain. Okay, so he refused to give it to his wife, guys. Gregory Urich shot 5 healthcare workers and detonated 3 pipe bombs at a clinic in Minnesota in 2021 after his doctor stopped prescribing painkillers. You see this? I've never even heard of these stories, okay? And it's my job to bring you guys all of these opiate stories, because when we had the crack epidemic, they was down our throats. Every single person that had any kind of influence made all kind of reports about crack. You know, they didn't miss a beat. So, like I said in the intro, anytime I see an opiate crisis, I'm going to bring it to you guys. Like, this is ridiculous. This man shot 5 healthcare workers and he detonated 3 pipe bombs. I never even heard of this. Okay. The stories persist, including the recent killing of Dr. Preston Phillips and 3 others at St. Francis Hospital in Tulsa, Oklahoma on June 1st. Okay, so this one just happened. Okay, but I didn't even know Dr. Phillips lost his life. R.I.P. to Dr. Phillips, man. Rest up. And these other 3 people too, you know. This is just a tragic situation. Those withdrawals for the opiates must be something crazy. It has to be for these people to want to hurt someone for not giving them their fix. Okay, the shooting reportedly happened a day after the government complained of pain from back surgery performed by Phillips the month before. Police recovered a letter the government had on him detailing how he was killing Dr. Phillips and anyone who came in his way. Police did not say whether the government was seeking opiates for his pain. What do you mean? You don't have to tell us that the government was seeking opiates. We can tell he was. He got back pain. Okay? And opiates is number one thing for pain right now. So the doctor was like, no, no, no more. No more. And he's like, I need those opiates. Purdue Pharma introduced Oxycontin in 1995. A version of Oxycontin that was heavily marketed to physicians as a gentler, less addictive opiate pill. The company's aggressive marketing successfully normalized prescription opiates for pain of any kind, despite the lack of evidence that they should be used for common conditions such as back pain and arthritis. Okay? Even I felt comfortable writing opiate refills for a colleague's patient. I had never met or given opiates to my 82-year-old patient with debilitating arthritis of the hip, and when the increased volume came addiction overdoses. In 2012, there were look at this guys, 255 million prescriptions written for opiates with a dispensing rate of 81 prescriptions per 100 people. And how many of those people are African Americans? See, this is why it didn't happen to African Americans. Well, I mean, I've met some African Americans who have overdosed when I was in West Virginia, but it's not too many African Americans who overdose on opiates because we don't. It's like a loan. It's like a bank loan. They don't want to give it to us. See, this is what they get. That year, 16,000 people died from an opioid overdose. Okay? So, besides everything I'm saying, RIP to everybody who has died from opiates. Okay? I've been in West Virginia. I've lost plenty of people I know from opiates. So don't take this video the wrong way. I'm bringing this to light because I've been personally affected by it from people I know. Okay? Only thing I'm saying is African Americans didn't get a chance to really get opiates. Now let's say opiates weren't as bad as they are, and they do help you for pain, and they weren't as addictive. We as African Americans would have been left out. So think about it in that way, where if the pills weren't as bad or they didn't make you overdose or harm you, that'd be a great thing to have. And African Americans, we don't even get a chance to have it. They deny us our prescriptions. They don't write no prescriptions for us. Not like that. In 2016, researchers found that more than 11.5 million Americans have reported misusing opiate prescriptions in the past year, underscoring that while there are valid uses for such medications, the United States simply had too many opiate pills and medicine cabinets. If that sounds familiar, think of the debate we're having about guns in this country right now. Right. So many people using their guns for bad use. Okay? So many people out here hurting people with guns. Alright? And there's so many people out here abusing the pills. The worst outcome of our nation's inability to manage double epidemics of opiates and guns is the complete breakdown of the relationship between doctor and patient. The nation labeled and then grappled with reversing these trends by introducing criminally, scrutiny, and regulation in the form of prescription drug monitoring program limits on the quantities that can be prescribed, and state medical boards investigating high volume prescribers. These efforts have started to yield results, but something else started to happen. Millions of addicted patients began to resort to desperate measures to self-medicate when the generous supply of prescription drugs started to dwindle. Right. So you can't have doctors, physicians prescribing opiates for so long because of how much money the pharmaceuticals companies were giving them. Okay? It's a contract that the physicians and the doctors have with the pharmaceutical companies. So once it hit the fan and people start dying, now you want to prescribe them less. That's not going to stop them. They're already fully addicted. Now they're going to go get fentanyl, like I talked about in my last video, which is another opiate or ingredient that you can put in the opiate and make it way more dangerous. Patient would lose fake names in different emergency rooms around the city to receive opiates. That's just crazy. Others would steal from friends and relatives, and too many relied on non-prescription sources, which too often proved fatal. Some physicians I worked with instituted a strict no narcotics policies to avoid writing any prescription, while others would state that they will only prescribe up to 5 days and will require an in-person office visit for reevaluation. 5 days? From the things I've been reading, you only need one time. For some people, if you got addictive personality, 5 days, that's a wait enough time. You know? The programs that could help transition addicted patients, such as buprenorphine treatment, which can be administered safely in physician offices, are still too few and far between due to stigma. We don't want addicts in our waiting room. Regulatory bureaus prior to 2021, there were limits on who could prescribe the drug. Financial considerations, reimbursement felt to be too low, and lack of time. Okay. This is talking about gun violence. These days, doctors, including myself, have taken measures to mitigate risks and protect ourselves and our staff. I have dismissed patients to get them out of harm's way, worked in clinics with panic buttons, and asked to reconfigure exam rooms so that I am closest to the door. Recent events will likely provoke more conversations of increased security presence or added barriers to access in hospital and medical centers. Okay, the worst outcome of our nation's inability to manage double epidemics of opiates and guns is the complete breakdown. Okay, I already read that. Let's see. Preventive measures to deal with violence, such as security and panic buttons, can create an immediate assumption that the patient waiting in the room or on a gurney is guilty until proven otherwise. A flag in the electronic medical record that is commonly used to make prescribing physicians aware of the use of opiates also paints a scarlet letter before the doctor even sees their face. Okay. And this guy got shut down. Look at this doctor. Google had to shut down this page, but not because he was murdered, but because the day he died. Okay, now this is Dr. Phillips. Now, it says he got hundreds of one-star reviews saying how he deserved to die for being empathetic enough, for not being empathetic enough. Okay, now, how many Caucasian doctors prescribe opiates? You know, don't try to just single out the brother because it's all physicians. You know, all physicians of all races are giving out these pills. And they're taking people out. Okay? And like I said before, I will be covering more opiate crisis, opiate issues, fentanyl issues. Because some people understand this epidemic, but it's not talked about as much as it should be talked about. This is a big issue. Okay? They're talking about arming waiting rooms. Because these people going to come in there and want to harm the staff because they want to get their fix. But like I always say, I will see you guys later in the next one.